Next, we're going to learn a little bit about Am I Cleared? Consideration of Sports Participation Physical Exam by Dr. Daniel Montero, who trained in Virginia, initially born and raised in Virginia, and went to undergraduate at UVA, and I think they even have a basketball team. And then Eastern Virginia Medical School, and then also did some training in Ohio State in sports, and then family med in Jacksonville, if I have it all right. And he's currently on staff in orthopedics and sports in Mayo Clinic Jacksonville.
How many people do the sports physicals? Raise your hand. Great. How many of you are volunteer team physicians? Okay, great. High schools? Colleges? Okay, good. And for those that you didn't raise your hand, hopefully after some of the lectures you'll be a little more comfortable in doing so. How many prefer doing your sports physicals in the office? Okay. How many prefer the big, large group ones? And who has done one of these mass physicals where you get 500,000 kids rolling through at a local high school or a local hospital? Anybody done those, been part of those? Okay, good. Yeah, and there's good and bad with both. So what I want to do really is kind of review some of the evidence. The fourth edition monograph was 2010. So there are a few things that have probably changed over the last 8 to 9 years in terms of what was in it, but kind of go over the most recent evidence-based guidelines, really kind of focus on the history, what should you be looking for. We're doing more of a cardiovascular type of screen so we can find those needles in a haystack, what's most important on the physical exam, and then talk a little about clearance to play, some of the things that might come up and what you can do about them. So you can do the monograph and look at 150 pages, or you can do the Cliff Note version. So I send you this reference here. This is from 2015. So 5 pages to me is a lot more palatable than the monograph, but the monograph is still nice for other references and tables. Some of those key recommendations that come up. You want to do your clearing physical about 6 weeks before, because if you do find something, and if you do enough of these, you should find athletes with something. You've got time to get them over to a specialist and get them cleared. Everyone should be questioned about exertional symptoms, heart murmurs, any history or family history of Marfan syndrome, and then any kind of premature problems with heart or just premature